This video is for part 3 of the Alabama practice, hopefully the last one, but looking at my notes there might be another one. So I'll try to go a little faster though. So some rules of Alabama pharmacy. So your sources of info provided to secretary is confidential. Sources of info about violations of laws. Info cannot be disclosed to board members or inspectors. Technical equipment required. Most recent facts and comparisons or other practice references. Alabama Board of Pharmacy allows the use of electronic medium references, hot and cold running water in prescription area, balanced with appropriate weights. Other reference or equipment necessary for the level of practice, like if you're nuclear, you need those references, must have the same at satellite pharmacy, except for the weighing equipment. Prescription files, initials of person who compounded/dispensed, prescription number and date dispensed. Absence of pharmacist supervision on assistance. So I'm going in order. That was 205, this is 206 from the 680 X2. So 206, absence of pharmacist must have a sign posted prominently in prescription counter, easily viewable by public. Provide pharmacist name, hours away, telephone number, address where pharmacist can be reached. If alternate pharmacist used, must provide the name, address, and telephone number of the pharmacist can be reached. So this is if they have that assistant that I mentioned in about 2 videos ago. Pharmacists must be able to return within 30 minutes at request for the pharmacist. So mail order prescriptions, registration is required, permit renewed biannually, must assign an in-state agent of record, must have a designated supervising pharmacist. Some conditions: provide toll-free telephone number for consultation with pharmacists, designate a supervising pharmacist that is licensed in Alabama, notify within 10 days of change and less than 90 days without one. For pharmacist consults, consults shall be registered and licensed by Alabama Board of Pharmacy. Alabama Board of Pharmacy maintains a roster to continue education for pharmacist consults, so not less than 12 hours a year and 1 approved for consultation. Registered consults hours cannot be carried forward. Initial certification must be exam and 10-hour approved course, and you have to have a score of 75 or higher. Preceptor training, a minimum of 2 years as licensed pharmacist, approved by the board, attend approved seminars at least every 3 years. So, reporting place of employment, interns and externs, 210. So a pharmacist intern and extern within 10 days of change. So if you're studying right now and you decide to get a job before you take the MPJE or the exam, and you haven't had it, you or whoever you work for has to notify the Alabama Pharmacy within 10 days of the change. Pharmacy keys and other controlled access devices are methods, and there's typically always a question on this from my understanding. Licensed pharmacists must have the keys. Owner may designate one unregistered person to have keys. Supervising PharmD and Alabama Board of Pharmacy must approve of the one person. Permit holder must execute a signed agreement. You can have a knockbox or other system for accessing the key or other device, and it's okay as long as it's hooked up to an alarm. Emergency action plan to give pharmacists access to the pharmacy in emergency is necessary. So your supervising pharmacist, also, easy question. There's always one. There's one per pharmacy in Alabama. The name has to be posted in the department. You can go to any pharmacy and see their supervising pharmacist right now. And it's one pharmacy unless they have approval from ALBOP, and it's 15 hours a week. So you may supervise 2 pharmacies with board approval if that pharmacy is open less than 15 hours per week. Supervising pharmacists, 50% of hours the pharmacy is in operation or at least 30 hours per week. Notify ALBOP within 10 days of change of supervising pharmacists. They have 15 days to do an inventory when they start the new job. A supervising pharmacist is pretty much responsible for everything. And do notify Alabama Board of Pharmacy of any termination. The permit holder, who must execute that signed agreement for the keys. The corresponding responsibility with supervising pharmacists, so they both have this responsibility of going over the pharmacy basically. If there's no supervising pharmacist, notify the ALBOP within 10 days, and you cannot exceed 90 days without a supervising pharmacist. Your permit would be in violation. If it's greater than 90 days, ALBOP may ask you to close. Now, prescription label 213, you have to know this. And it's pretty easy. You've been doing it for a long time. So it needs the pharmacy name and address. You need the name of the drug dispensed and the manufacturer. You need the strength of the drug per unit, the practitioner's directions for use, Drug name and strength may be excluded at request of prescribing physician. If a compound, it can state prescriber's mixture. Directions for use may be excluded for hospital patients on unit dose meds. Alright, so 680, practice of pharmacy. It's pretty general. You definitely know this, but you can also administer per Alabama law. You don't really see this in practice, and if a drug is over the counter, you can sell it over the counter. No restrictions on the number of syringes and needles or pens a patient can get. So on to the role of technicians. Technicians, of course, shall not document receipt of controlled substances. I think that's one that got me when I was reading this. Some qualifications of technician: they have to be at least 17 or older. Submit a RIP application for registration. Cannot be a pharmacist whose license has been suspended or revoked. They have to wear an ID tag. And notify Alabama Board of Pharmacy within 10 days of change of employment. That one live CE must relate to pharmacy tech work. They do require a background check. So computers for record keeping is allowed by the state. If control DEA and state number required, ID of pharmacist. Must be able to provide a full refill history. If there's a printed hard copy, it needs to be verified, dated, and signed. If there's a central location, there's 2 business days to produce those records. Backup procedures in the event of the system is down, or auxiliary procedure. Consecutive numbered prescriptions. Some practical training, which is kind of, what you just got through. 1,500 hours, 400 hours after second professional year, 400 traditional pharmacy setting. Must be employed a minimum of 4 hours per week, max of 40 hours per week. 1 hour per day at least. Let's see. Pharmacists may supervise no more than 3 interns or externs at a time. You should notify the Alabama Board of Pharmacy of employment, practice site, termination, and change within 10 days. So institutional pharmacy is what we're at now. So of course that's a pharmacy in a hospital basically. And it has a supervising pharmacist. If there's an absence of the pharmacist, there's a locked cabinet or protocol for emergency access to pharmacy. Like you see this a lot in rural hospitals. There's a drug cabinet. Outside pharmacy are accessible by key or code by authorized personnel. Inventory listing and protocols for uses of drugs. Prepackaged, properly labeled drugs only. Sufficient drugs for therapy required. Written prescription orders required per access. Inventoried at least each 30 days. Audit each 30 days. Written policy and procedure. Emergency access to pharmacy. So drugs not available on the floor or in the cabinet. Required for immediate use treatment of a patient. There is 1 supervisory nurse or physician / shift designated, and typically when that happens, they end up adding it to the cart, so that doesn't happen again. In my experience, person designated is in writing. There's to document patient, room number, drug strength, amount, date, time, and signature of employee. So if there's no pharmacy, there's the emergency kit, the crash kit. Drugs are effectively managed a critical care incident. List of drugs maintained in facility at a pharmacy and the pharmacy supplying the drugs. The kit is provided and sealed by a pharmacist. Pharmacists and institutional staff to determine drugs in kit. Stored in secure area. Kit properly labeled and labeled with a list of drugs. Name, address, and telephone number of the pharmacist. Pharmacist to be notified if the kit's open. Drugs removed only with written order of prescriber. Expiration date. Notify supplying pharmacist with reasonable time. No more than 72 hours. The stat cabinet has non-controlled drugs to manage patient drug needs, not available from other sources, insufficient time. Only 1 per faculty without additional approval by Alabama Board of Pharmacy. It has to have a list of contents, appropriate records, protocol for use of stat cabinet and replacement of drugs, inspected monthly. For long-term care facilities, drugs to be determined by facility, and there's no longer a limit on the number of drugs. Appropriate packaging reviewed annually by pharmacists, the drugs at an LTCF. For drug distribution and control, supervising pharmacists shall have a written protocol for this, and it's updated annually. If a patient has medications that are not to be administered, you must remove, give to family, or follow an established protocol. Investigational drugs for inpatient use are stored in and dispensed from pharmacy. Info on med is stored in the pharmacy. So automated dispense systems and skilled nursing facilities, which have to be approved by the Board of Pharmacy, but store and dispense meds under responsibility of a managing pharmacy, considered an extension of the managing pharmacy. This is ER meds, which are drugs including controls ordered in response to emergency. These are stat meds, drugs included, controls ordered and needed before supplying pharmacy could supply. Must have written policies and procedures and Alabama pharmacy approval at least 30 days prior to installing and using an automated dispensing system in a skilled nursing facility. Access is via positive identification, password plus physical identifier like a badge or fingerprint. It can be accessed by licensed nurses, and then also pharmacists, registered pharmacy techs, and anyone authorized like for maintenance. Restocking is limited to the pharmacist, the techs, or the licensed nurse or other licensed healthcare personnel approved by the board. Quarterly inventory by the managing pharmacist as well. All right, I will upload another part. Thank you.